Venous thromboembolism, VTE, is a leading cause of cardiovascular morbidity and mortality globally. However, its significance is often underestimated, and awareness around VTE incidence, risk factors, signs and symptoms is suboptimal in contrast to other forms of cardiovascular diseases like stroke and coronary artery disease.
Venous thromboembolism, or VTE, is a cardiovascular disease that's characterized by the formation of abnormal blood clots in the veins. And most commonly this presents with clots in the lower limb veins, or the leg veins, or in the lung. VTE has an annual incidence in Ireland of about 1 in 1,000 adults per year. And it's estimated that our lifetime risk of experiencing some form of venous thrombosis is about 1 in 12. Globally, it's recognised that VTE is a leading cause of cardiovascular mortality, and it's estimated that VTE accounts for more deaths annually than road traffic accidents, breast cancer, prostate cancer and HIV-related illnesses combined. When we talk about risk factors, it's probably important to recognise that a significant proportion of people will develop VTE spontaneously. But there are definitely a number of risk factors which predispose people or which increase the risk of VTE. And these include things like prolonged hospital admissions, major surgery, for women, exposure to exogenous estrogen-based hormonal therapies like the contraceptive pill or HRT, pregnancy. And some of the most at-risk patient populations are those who are receiving therapy for cancer or any patient with active cancer. We've also seen a greatly increased risk of thrombosis in certain subgroups of patients with COVID-19, particularly those who have been admitted to hospital. Paramedics and other pre-hospital care providers play a crucial role in the initial assessment and triage of cardiovascular emergencies in the community, and we see this very clearly with the example of stroke and how advances around awareness and algorithms for diagnostics and therapeutics in stroke has been hugely augmented by the role of the pre-hospital care providers and paramedics. And so from a VTE perspective, we would also see a similar potential role whereby at the time of the initial assessment in the community, by assessing a patient in terms of the nature of their presentation, any risk factors which may have been present at the time for VTE, and by forming a working diagnosis of VTE and I guess communicating that to the emergency medicine care providers, this can potentially improve and reduce any delays that might otherwise have occurred in terms of identifying that a patient may be at risk of VTE, may have a VTE, and so will improve the speed at which these patients are diagnosed and treatment is initiated, which could be life-saving.
The concern with the DVT is not so much the problems in the leg, although it can cause long-term problems in the leg, such as swelling. It's more when the clot itself travels up through the venous system into the right side of the heart and into the lungs. And that's where it causes problems in terms of what we call pulmonary embolus, or a clot in the lung. And this can be a life-threatening condition. So it basically can cause shock. So that can cause hypotension, low blood pressure, collapse. Obviously, the spectrum of presentation of a pulmonary embolism is wide. You can have more minor symptoms, such as chest pain, shortness of breath, coughing up blood. You will have tachycardia, tachypnea, fast heart rate and a fast respiratory rate. Sometimes can get a temperature with it, and these can all be signs of a pulmonary embolism. But the one we really worry about is the massive one that causes that blockage and causes a collapse. And so a collapse can be a presenting complaint of a pulmonary embolism. There isn't always that preceding swollen leg. There isn't always that shortness of breath or pleuritic chest pain when you take a deep breath, or coughing up blood. So there's a wide spectrum of presentation, and that's why we have to keep our minds, keep this diagnosis on our minds at all times. So we just ask people to bear that in mind when they have somebody who's collapsed, or somebody who's very short of breath, or low blood pressure, fast heart rate, low sats, that kind of thing. It's important for us to know in advance when we're thinking about, particularly, the worst case scenario is somebody in cardiac arrest, and particularly a young person in cardiac arrest, which is very traumatic. So that's why it's crucially important for the paramedics, if they think that somebody might fit the bill, might possibly have a PE, that they relay that information, so we can be thinking about that in advance and perhaps preparing the treatment in advance. And it's always good to have information. The more information we have, the better position we are in to help somebody.
Last October, I had a foam sclerotherapy procedure done on the great saphenous vein in my left leg. Within a couple of days, I started to develop cramping, and it was swollen, but because there was compression bandage on it, I couldn't see the level of swelling. After about 2 to 3 days after the surgery, I had some kind of mini episode, I will say, event in my apartment, which prompted me to go to my GP. There was nothing significant when I went to see my doctor. I suppose I started to feel unwell when I was leaving my apartment that day. I remember I couldn't put the full weight on the left leg. I was kind of hopping a little bit, so I was using my husband for support. And suddenly I felt the clot get plugged right here in the center, and I was gasping for breath. It was extreme tightness. It was like I was drowning. I could barely talk, because I just couldn't catch my breath whatsoever, and it was getting worse and worse. I thought I was gonna pass out. At one point I thought, this is it, I'm gonna die. I told myself I'm gonna die. I felt like that was the closest I've ever come to that, and it was just so strange. My instant thought was, I need to call an ambulance, so I pulled the phone out of my bag and I called 999 straight away. And I just said to the guy on the phone, I said, you need to send somebody immediately, I can't breathe. I didn't have any chest pain, but they brought me into the ambulance. I think I desaturated to 90% or lower. So they gave me aspirin immediately. They were asking me lots of questions, if I have asthma, just mentioned that my heart rate was up a bit, but initially they had no idea what was wrong with me whatsoever. And then I was admitted to St. Vincent's emergency department, and when they did the CT scan, it showed a saddle P, which could have been fatal, because I think that's the most dangerous one that you can have. I'm in therapy to deal with the PTSD side of it. At the beginning, initially, I couldn't even leave my house because the memories, because it happened outside, it was, it just brought it all back again. It's changed me. I'll never be the same as I was before this happened. The past 12 months honestly have been hell, and luckily I don't have any hypertension in my lungs. I do have CTED, which is a chronic thromboembolic disease, just from residual clots that haven't dissolved. But other than that, I suppose my breathing it's a lot better now than what it was when all of this happened. Slowly, I'm back at the gym now. I'm back with a new personal trainer. Hopefully I can put this behind me and move on with my life as much as I can.
Improving awareness around this devastating disease in the community and among healthcare providers is crucial if we are to improve patient outcomes and avoid preventable morbidity.